Thanks again for tuning in to part two of Let's Talk Prostate Health. I'm John B., the NP, nurse practitioner as always with Innovations Wellness. This video is a continuation from part one, obviously. We left off talking about different issues that affect the prostate. So let's jump right back into where we left off. One thing that we all take for granted is the ability to urinate without any issues. It's just a normal thing for most of us, and when we have no issues, we don't even really think about it. It's one of those processes that takes quite a few things to work correctly for our experience to feel effortless. That brings us to the first issue that we talked about in part one, which was benign prostatic hyperplasia, or better known as BPH to most people. It's very common issue for men. As we get older, our prostates are going to continue to grow as long as you still have one. But trust me, it's going to continue to grow. You may not be aware of it, but that's not a bad thing because that means that you're likely not experiencing some of those lower urinary tract symptoms or bladder outlet obstruction issues that you may experience if you have issues with your prostate. So now let's talk about those men that are experiencing LUTs. LUTs can be nocturia, urgency, frequency, urge and overflow incontinence, hesitancy, dribbling of urine at the end of the stream, and incomplete voiding. And if your BPH is severe and prolonged, urinary retention, awful. And yes, that's correct. It's quite a few symptoms that go along with this issue. Normally, urinating is relatively easy process, pretty passive. Most things that are happening within the body to make this happen, we're not generally aware of. But when our prostates are enlarged and causing us a problem, urinating can be very troublesome. The prostate can actually push upwards into the bladder, and it can get narrow internally within the prostatic urethra. This is a perfect storm for problems to begin. This is when men begin to notice symptoms a lot of times. As men, we remember the days of urinating like this. But when we start to experience prostate enlargement issues, our stream can become noticeably less forceful, and we may end up like this. Now listen to me carefully, guys. If you end up with this every time you urinate, then you, my friend, need to be seen by a provider as soon as you can, before it turns into this. As you may see that, the progression of bladder outlet obstruction with the enlarged prostate. Now, one of the most important things you can do is a voiding diary. This will help you keep track of all the symptoms that you're having that may be worsening. You can also change some of your behaviors. Now, one of the examples of behavior change is don't drink any fluids within 2 hours of bedtime. We all can do that, but most of the time we don't like to do that. See if that helps keep you from waking up at night so much. Another thing is to utilize the IPSS, or International Prostate Symptom Score tool. You can find one of these online at the web address that I have provided for you on the screen. And lastly, what is your prostate-specific antigen, or PSA blood level? Treatment options for BPH tend to focus on symptoms. Whichever symptoms dominate leads you in a certain direction. So if you have overactive bladder symptoms like frequency and urgency, then the best route is to start with learning healthy bladder habits and, possibly some overactive bladder medications such as oxybutynin. If symptoms are more related to true BPH, like hesitancy, decreased force of stream, nocturia, and dribbling of urine, then it's likely that you'll benefit from an alpha blocker such as tamsulosin. The brand name for that is, everybody knows, is Flomax. Or, a PDE5 medication, which is frequently used for ED, called tadalafil. The dose of tadalafil is lower for BPH, and it's taken daily. And in some cases, finasteride or dutasteride may be needed. If you feel satisfied with these medications, then you should stay the course. In the event that these medications do not improve the quality of your life, it may be best that you see a urologist for, anything that may need to be surgically evaluated or evaluated for surgery. In the event that you need one, I know quite a few excellent urologists in the Atlanta metro area. So reach out to me for any recommendations that you may need in that area. So once again, thank you guys for watching and listening, and I will see you next time.